Hi, my name is Danielle, and I'm from the Center for Autism and Related Disabilities here at the University of Florida in Gainesville. Today I'm going to be talking to you a little bit about picky eating, which we know is a pretty big problem for a lot of kids on the spectrum. To tackle picky eating, there are several strategies that we know to be effective. The key is to pick the one that's right for your child or client. So here are a couple of tips. The first one is consider the child's prerequisite skills. Do they have good oral motor behaviors? Do they have good sitting at the table behaviors? Do they have a way to tell you that they're all finished or no thank you? Those are things you want to make sure that they can work on and have relatively mastered before you go ahead and start tackling the picky eating part or the food selectivity part. The next part, speaking of food selectivity, is the food selectivity assessment, which is basically an understanding of what the child currently eats, if there's anything that the child has eaten in the past but no longer eats, what the family's priorities are in terms of what types of foods they eat regularly. The goal is to not have to cook 2 meals a night. The favorite food and drinks that the child might have, and then any medical or dietary restrictions or history that might play a role. Getting started. The first thing that you can do is target sitting at the table if necessary. A kid can't eat at the table if they don't know how to sit at the table first, so sometimes we'll target that specifically. Another thing we can do is modify the portion significantly. So sometimes when a child is presented with a big plate full of food, that looks like a pretty overwhelming amount. So sometimes we'll just give a few bites to indicate, this is what I need you to do today. And sometimes just by presenting the food that way, it can make a big difference. Another thing we encourage families and schools to do is to limit the child's fluid intake. Not water, of course we want them to be hydrated, but water, aside from water, we want to think about things like juice and milk and especially sugary drinks or sodas, anything with bubbles, because that might fill up the child's belly in a way that might not give them the sensation of being hungry. Eventually we want kids to be able to eat when they're hungry and stop when they're full. That's the natural way that we eat. And so if kids' bellies are filled with bubbles or milk or other sugary things, they might not get that sensation. And then the other thing is to avoid mealtime clutter and distractions. So if your kitchen table is the same place where you do homework or art projects and things like that, just make sure that during mealtime, all of the remnants of those things have been taken away so that there's no confusion about what's happening during the meal. Another strategy we like to use is just a very basic first and then. So first I need you to sit at the table, then you can get a treat, or then you can go watch a show, or etc. So getting the expectation started about what I'm going to want you to do when you sit here. A couple of other tips. You only want to target one food at a time. It's very overwhelming again when kids are introduced to a food that they haven't seen or tasted or maybe even touched before. And so we want to make sure we're doing that in a relatively slow fashion. Ideally, you want to target a food that matches in some way some of your child's preferred foods. So for instance, if your kid is a crunchy kid, most of the things on his list are crunchy foods, you want to start with a crunchy food. I once worked with a client who the only food he ate was Cinnamon Life cereal. And so we started him on plain Life cereal, and Mom said, well, that's not any better in terms of nutritional value. And I said, yes, but the goal is to break the rule that he's created around, I don't eat that food. So once we were able to get him to break that rule by accepting different types of Life cereal, then we introduced other cereals, and then crackers, and then bread, and then sandwiches, and so forth. Another tip, you can also use first and then to say, first I need you to eat this piece of chicken, and then you can be all done. Or first you need to eat 2 scoops of applesauce, and then you can be all done. Another strategy, which is one of my favorites, is called a countdown board, and I'll often create a board with tokens or stickers or poker chips. And instead of a reward board where the kid gets a sticker every time he takes a bite, in this case, the token chips, for instance, represent each bite he has to take. I don't know about you, but I know a lot of kids who do not like when foods are cut up into bites. Even if it's a piece of pizza or a sandwich, something like that, they want it to look whole. And if you cut it, they won't eat it. The problem is, if you present a kid with a whole sandwich, the chances of them being willing to eat all of that are minimal. So instead of cutting the sandwich into 3 bites and putting that on his plate, I might show 3 poker chips. And every time he takes a bite, I take a poker chip away, representing that bite. And when the bites are all gone, he's all finished. Another way that I do that is using a placemat. I'll just put regular old clothespins at the top of the placemat, and each one represents a bite. When they take the bite, I take the the clothespin away, and when the clothespins are all gone, they're all done. Of course, over time, you'll go from 2 clothespins to 4 to 6 until he or she is eating a relative portion. Another strategy we use is called desensitization, which means just getting used to the presentation of this other food. So you would prepare the same food that your kid would typically eat, but on the side, on a separate plate, you would present the new food. And then a few days later, after praising him for tolerating having the new food in his presence, you would put the new food on his plate, but separate, not touching. Then you might praise your kid a couple of days later for being willing to smell the food, and then touch the food, lick the food, and then of course to taste and eat the food. You're going to keep your bites small, and you're going to use the same food every time. Another strategy is condiments. So I know a lot of kids who like condiments, and actually in my experience, they tend to like really spicy and hot or strange condiments, but whatever works for you. So if it's ketchup or mustard or barbecue sauce or soy sauce, whatever it is, you put a great generous portion of ketchup, for instance, on the non-preferred food, and then you serve the bite that way. And over time, the size of the bite gets bigger and the size of the condiment gets smaller. It masks the taste, but they're still consuming the food, and since you're decreasing the amount of condiment each time, it makes them more and more tolerant of the new food itself. The next one is called a preferred food vessel, so it's kind of the opposite of condiment. So let's say I'm teaching the child to eat strawberries. I might put a strawberry on top of a pancake, which happens to be a favorite food. So you use a favorite food as a delivery or a vessel for the non-preferred food. And again, the size of the favorite food gets gradually smaller, and the size of the non-preferred food gets gradually bigger until the child can accept it on its own. Another example is a chaser. A chaser is when you use a preferred drink or beverage as the thing that they can kind of swallow the non-preferred food down with. The key to this is that it should not be a drink that they otherwise get to have. If they can have chocolate milk any day during the week that they want it, they're probably not going to want to use it as a chaser / reward for eating a non-preferred food. But they chew this food and swallow it, and then they follow with the chaser. And again, the amount of liquid that you offer to swallow as a chaser gets smaller and smaller over time until they don't need it anymore. So how do we deal with meltdowns? We're going to talk in another series about working in restaurants behavior-wise. So we're going to get to meltdowns a little bit more then, but I want to give you a few tips, and that is, ask yourself if the expectations are clear. Is it very clear how long my child has to sit here, how much I want him to eat, what he gets if he eats it, and what, if anything, happens if he chooses not to eat it? You want to make sure that your child knows all those things with your words, with pictures and timers and routine. Because if you do, then you know that when your child sits down, they've agreed to what it is you're asking them to do and they understand it. Another thing is you might say to myself, how can I modify my expectation today? So I really wanted to work on 6 bites of chicken today because he's been doing so great. But you know, he got through 4 and he's doing really well, and I don't want to have him leave the table really discouraged or upset. So I might say, you did a great job today. 1 more bite and you're all done. So even though in the end he only ate 5 bites instead of 6, at least it was a successful event. He left feeling successful and positive, and you didn't have to deal with a meltdown. And then lastly, does your child have an appropriate way to escape or say no thank you? All kids have the right to say, I don't want that, no thank you. Now sometimes, of course, we'll have to negotiate a little bit with them, but we don't want to take away that right. So make sure your child has several ways to say, all done, break, no thanks, those kinds of things. A couple more important tips before I go. The first is, don't try to sneak foods in, because if a kid realizes that you're trying to sneak a food in, he's going to start becoming suspicious of all food. And then we have kids who get even pickier, because now they start refusing their favorite foods, thinking you might have snuck something in there. The only time that I would break that sneaky rule is if the child has medical issues that would suggest that he's not getting the proper nutrients. In that case, you would want to sneak them in a way that they can't distinguish. You might put some extra things into a smoothie, for instance, or into a casserole. But typically, kids who are picky don't like foods that have mixed textures anyway, so they're probably not likely to eat things that are too mixed in texture as it is. Don't introduce more than 1 non-preferred at a time. Don't forget to offer choices. So even though the non-preferred food is not their choice because you've selected it, you might let them choose where they sit or what color plate they use or what their side dish is or what they drink. So you want to make it as meaningful as possible in terms of choices for your child. Try to reinforce your child for behaviors that are not related to mealtime. So if they're sitting quietly, if they're sharing, if they're using their napkin, all of those things that are other meal expectations that we have. And then lastly, don't forget to use visuals and praise to reward the behavior that you see. So if the child is sitting, you can say, I'm so proud of you for sitting, but you can also show a picture, you can model these behaviors. And then lastly, don't give up. Because even your typical kid, whatever that means, takes at least 7 to 10 times of exposure before they're even willing to try a new food. So if you have a picky eater in your classroom or your home, just keep trying and we'll help you get there. Thanks.